A diagnosis of a condition doesn't tell you how that person might be coping with the condition. It doesn't tell you how they perceive that condition, how they've emotionally responded to a diagnosis. Patient-centred care means putting people first. It's thinking about their beliefs, their values, their perceptions of the world. It's thinking about who else is in their lives. It's about thinking about their whole life experience.
So for example, there can be really significant loss after a brain injury, and it's really important that you think about someone's identity and what that loss means for them, so that you can build goals that align with them getting back to what they want to be doing in life. So for example, if someone has a really key value of community, how can we help them to become re-emerged in their community, something that they may have lost as a consequence of their diagnosis, and how can we do that perhaps in a slightly different way, but is still bringing them close to living with that value. So really kind of being the person that they always have been.
For us, kind of person-centred care is around ensuring that the person's voice is heard and is listened to, is validated, that we adapt our communications for the person that we're talking with in the room, and also to ensure that all of the clients that are seen in the clinic receive the same level of care and compassion and transparency, and that then enables us to build really good therapeutic relationships with our clients. And we know and understand that therapeutic relationships with clients is actually one of the main things that makes a big difference in terms of the effectiveness of an intervention. So actually for us, working really hard on that therapeutic relationship and making sure that we are empowering our clients as best as we can, that means that we can then make the most of any kind of talking therapy interventions and assessments actually within the clinic.